So good morning. I just want to start by saying that I just signed the $5.25 billion 1/12 budget, which was the amount recommended by the comptroller, and will make it possible for the treasurer to deliver local aid payments to cities and towns. We obviously look forward to working with our colleagues on the legislature during the month of July as some of the issues associated with fiscal 20 get a little clearer and fiscal 21 get a little clearer, to finalize what I would call a budget for the go forward on the rest of the year. But I want to thank the legislature for acting quickly on this one and providing some security and certainty to people with respect to how the new year will start here for the Commonwealth and for the Commonwealth cities and towns. Today, the Lieutenant Governor and I and Mike Keneally, Secretary Keneally, are going to discuss our plans with respect to COVID-19 economic recovery. But first, I want to provide a quick update on COVID-19 testing, cases, and hospitalizations here in Massachusetts. As we continue to gradually reopen Massachusetts, our public health data continues to trend in the right direction. Yesterday, over 10,000 COVID-19 tests were reported across the state, which brings us to over 1 million tests administered in Massachusetts so far. The level of testing we've been able to achieve makes us a national leader, and I want to thank all of the labs, hospitals, community health centers, and others who have made this possible. Yesterday, there were 226 new COVID positive cases reported. The 7-day average for positive tests here in Massachusetts has dropped to 1.8%. We also saw a drop in COVID-19 patients hospitalized, which is down now to 905. That represents a 75% decrease since the middle of April. 174 COVID-positive patients remain in the ICUs. We'll continue to monitor these public health indicators as additional industries and businesses and employers reopen and as we move through our phased reopening plan. And as we've said before, we continue to encourage everyone to wear face coverings, practice social distancing, and stay home if you feel sick. It's been working. It's worked well for the people of Massachusetts, and we all need to keep it up. COVID-19 will not be taking a summer vacation. As many people have seen, other states have suffered massive spikes in new cases and hospitalizations, and we urge every resident in Massachusetts to continue to be vigilant and mindful during their daily activities, that we can contain this insidious virus, but it's critically important for everybody to do their part. I think, as many people know, earlier this year, back before COVID, we filed an economic development plan here in Massachusetts, an act enabling partnerships for growth. The bill laid out targeted investments in housing, community development, and business competitiveness. Obviously, due to the headwinds that came with COVID-19 and the pandemic, a lot's changed in the last few months. Our goal remains the same, however, which is to create regional partnerships, growth, and opportunities for every community from the Berkshires to Cape Cod. However, COVID-19's impact on so many aspects of our daily life here in Massachusetts has changed our economic landscape. The pandemic brought with it a massive disruption to our economy. Cities and towns also incurred unexpected costs. We understand that the Commonwealth has a challenge before it as we move toward recovery, and Secretary Keneally and the Lieutenant Governor have had conversations with many folks on the Economic Affairs Committee in the legislature, including conversations directly with House Chair Representative Ann Margaret Ferranti and Senate Chair Senator Eric Lesser. So today, we're announcing a $275 million COVID-19 economic recovery package that's built upon the original legislation and based on conversations we've had with our colleagues in the legislature to spur economic growth for every region of Massachusetts. Specifically, we're seeking changes to our original bill to invest more in low-income communities, communities of color, and minority-owned businesses that have been particularly hard hit by COVID. Our cities and towns across the Commonwealth need support to confront the economic challenges that have been brought on by this virus. To address this, we're asking our partners in the legislature to consider amending the scope of several of our proposed programs targeted toward specific communities that have been hardest hit by COVID-19. Reallocating funding to tackle the significant economic impact of the virus while outlining a path toward recovery is our key objective here. And establishing new tools to promote equity and to drive economic growth in communities and among businesses that have faced long-standing barriers to entry in areas like state contracting. In order to do this, we're proposing an additional $15 million for neighborhood stabilization, which will bring that total to $40 million. Increasing funding for community development financial institutions by $25 million for a record level of $35 million to assist small businesses. And tripling funding for grants to support micro businesses from a total of $5 million to $15 million. These proposals will bring safe, affordable housing units back onto the market, give women, minority, veteran, and immigrant small business owners access to capital to grow their enterprises and support early-stage businesses with grants and technical assistance. We're looking forward to working with our colleagues in the legislature to help us update this important legislation to provide relief and opportunity from the impact of COVID-19 and to make progress in addressing long-standing equity issues here in Massachusetts. The original legislation was developed with input from public and private sector partners, local officials, and many other experts. And we're deeply grateful for the legislature's commitment to moving forward on a recovery package during the last few days of the legislative session. Since the end of the formal session is right around the corner, we hope this bill can move quickly so that we can give communities and small businesses across the Commonwealth the tools and the support that they need to recover and move forward. I'd now like to turn the podium over to Lieutenant Governor Polito, who can talk a little more about some of the details.
Thank you, Governor. Last spring and summer, under very different circumstances, we held engagement sessions all across our Commonwealth, which led to the development of our plan and our legislation entitled An Act Enabling Partnerships for Growth. 4 goals came about as pillars of our plan: responding to the housing crisis, building vibrant communities, supporting business competitiveness, and training a skilled workforce. While these goals remain the same, the changes we're proposing will produce stronger legislation to assist our economic recovery. As residents face increased economic insecurity and high housing costs, increasing state investment in distressed homes is critical to bringing safe and affordable housing units back on the market. We are proposing to increase the plan's funding for neighborhood stabilization to $40 million, an increase of $15 million from our original legislation. Cities and towns also need additional tools and flexibilities to build vibrant communities. And to make this possible, our legislation includes the following: $40 million in funding to prioritize the redevelopment of underutilized or abandoned properties. $5 million to support local growth planning projects. Due to the pandemic, municipalities' need for increased capacity and technical assistance is larger than ever, and it will help communities find creative ways to plan and process permits in this new environment. This support will help municipalities work on housing and economic development goals and unlock potential in their downtowns and main streets. And as we think about our communities, our small businesses are top of mind and a very high priority. Due to COVID-19, gaps worsened for small businesses that were not able to take advantage of the federal programs. Today, we propose increasing funding to community development financial institutions, or CDFIs, to direct loans and assistance to small businesses. Increasing CDFI funding to record levels of $35 million will allow the state to invest in more small businesses, including minority-owned businesses. We are also proposing to triple the BizM Power program. With $15 million, Mass Growth Capital Corporation will grant grants, and these grants will match crowdsourced funding raised by micro businesses. In addition, our proposal gives preference to businesses that are low or moderate income area or are owned by women, veterans, immigrants, or minorities. The Commonwealth's dynamic and diverse business ecosystem is core to our continued success and to growing our economy as a whole. While we continue to battle COVID-19, we can't lose sight of our strengths and what makes Massachusetts a leader in so many industries. Our small businesses throughout the Commonwealth have been very patient and cooperative as we have combated the COVID-19 and continue to do so. And they have certainly sacrificed a lot in the interest of our public health and our safety. We are grateful for their continued cooperation, and while we keep striving to grow and build our economy, we must first help many of our small businesses bridge the gap to reopening and reach recovery and to reach higher levels of stabilization and opportunity. All across our Commonwealth, we will support our regional economies, and we will work together to reopen, to rebound, and grow stronger and better than ever. I would also like to join the Governor in thanking our partners in the legislature. We spent a lot of time with Chairwoman Ferrante and Senator Lesser to craft the original economic development bill. We appreciate their holding a hearing this afternoon to listen to many of the stakeholders who helped craft the original bill and to consider updates that are really important to this reopening and recovery process. We thank them for their leadership, for their important work, for their partnership, and the effort to produce a bill that will be responsive to both the near-term needs of businesses as well as our longer-term goals to strengthen and grow our Massachusetts economy. With that, I'd now like to turn it over to Secretary Keneally.
Great. Thank you, Governor and Lieutenant Governor. I want to join the Lieutenant Governor in thanking our partners in the legislature for their collaboration and their commitment, and we look forward to further collaboration as we go forward here throughout the legislative session. Through our economic development legislation and the updates that I'll discuss with the legislature today, we have a great opportunity to take a really good bill and target it even more toward advancing equity, a challenge that long preceded COVID-19, as well as economic recovery from this devastating pandemic. We look to stabilize the neighborhoods that were hardest hit, to support minority-owned businesses with record levels of funding, and to position the state for continued growth in emerging innovation sectors. We seek to fund even more affordable housing and develop more housing in our gateway and similar cities, many of which were hit extra hard by the pandemic. COVID-19 has really sharpened the need to address the housing crisis. The virus has demonstrated how important stable housing is to staying safe, socially distancing, and continuing to work from home and teach our children. Our high cost of rent across Massachusetts creates enormous challenges. Many households, in an effort to make rent, live in crowded quarters. Oftentimes, this includes multiple generations of families, from newborns to the elderly. The Health Equity Advisory Group recently issued findings and recommendations on the disproportionate impact of COVID-19 on communities of color. By no surprise, housing is identified in that report as a hugely important factor for better public health outcomes. Social and economic factors are known to be big contributors to what makes us healthy, but our current housing crisis forces families to sacrifice other priorities like food, clothes, and healthcare. Zoning laws around the country have been a tool used to exclude. The current system has produced harmful results for minority populations and communities before COVID-19, and it now produces consequences that are outright dangerous to these communities during the outbreak. This is a chance for us to find new ways of encouraging housing production at the local level. The housing choice reforms still included in this legislation are designed to foster more production and to promote equitable access to opportunity while respecting the local decision-making process. It does this by enabling cities and towns to adopt certain zoning best practices through a simple majority vote rather than the current 2/3 supermajority. Without meaningful zoning reform, we will continue to see more of the same: negative impacts on equity, housing affordability, and access to jobs. Massachusetts is one of just a few states that requires a supermajority to change local zoning, which means even when a town meeting or city council forms a majority consensus around the need to increase housing, it only takes a small minority to stop it. To be clear, the housing crisis will not be solved by one piece of legislation, but this package today will put our state in a position to produce the housing we need to meet our current demands. Why should we continue to prevent a community from producing more housing, especially multifamily housing in downtowns and near transit? And we're optimistic that the time is ripe for real, lasting change that gives cities and towns the flexibility to do what they know to be best for their communities. Beyond these reforms, our proposal will continue to fund transit-oriented housing, as well as sustainable and climate-resistant affordable housing, with new language that modifies income thresholds to increase affordability. The bill will also allow the Housing Development Incentive Program, or HDIP, to meet growing demand for market-rate housing in gateway cities and enable similar communities to use this tool. More housing creates more economic growth, something we need as we transition from reopening to recovery. More housing benefits public health as we continue to fight the pandemic. And more housing will help us to achieve greater equity, something that we all must continue to fight for every day. Thank you.
Questions on this?
Governor, can you talk in perspective? I mean, are we ever going to get the economy back to where it was before? A lot of people are thinking that we just open everything up and we'll be fine. And then maybe explain how the program here, the principles of it, will get us at least closer to what it was before.
Well, so I'll start where Secretary Keneally ended, which was the conversation about housing generally. There's no question that COVID-19 has laid bare a number of significant issues and challenges for urban communities, and especially urban communities of color, many of which relate to the lack of affordable housing in those communities. And we've been working for 2 years to try to get legislation passed that would make it easier for communities to build more housing. And we signed the largest housing bond bill to support the development of affordable, moderate, and transit-oriented housing 2 years ago, 3 years ago now? Was it 2 years ago? We have a ton of dry powder, in other words, and it's very hard to put it to work because it's so hard to actually get housing projects approved, especially in many of the communities that we're most interested in seeing that development in. And I live in Swampscott, but my good friend, Mayor Driscoll in Salem, which is a thriving community that has done extraordinarily well under her leadership, has suffered terribly because they can't create the housing that their community needs to serve the people who currently live and work there. And she has an 11-member city council, which means any housing project that she wants to move forward has to get an 8-3 vote out of that city council. Over the course of the last several years, I would say somewhere between 5 and 10 times, she's gone before the city council with a variety of projects at every level of the housing, senior housing, affordable housing, workforce housing, ancillary dwelling housing. I mean, almost everything you can think of that would be a part of trying to create more housing opportunities, more affordable options for people in Salem, and she inevitably gets a 7-4 vote. Now, I think a 7-4 vote should be enough to move a housing project forward, and most people, I think, would agree with that. But in Massachusetts, you need 8-3. If you live in a smaller community where you have a 5-member select board, that 5-member select board can't vote 3-2 and have that be a positive development with respect to moving forward on housing projects. You have to get to 4-1 because 3.2 is 60/40, and you got to get to 66.5, 67 to move a project forward. Now, there's a lot of money in this bill. There's a lot of money in the housing bond bill to develop and support the creation of literally tens of thousands of units of affordable workforce, transit-oriented, and moderately priced housing and senior housing. And a lot of it would be built in places where we all know we need it and where COVID-19 has made absolutely clear it should be an imperative that it get developed. But until we change some of these rules around the process through which we actually develop housing, the process is going to continue to take too long. And in many cases, a small group of people will be able to say no to projects that more than half the people in the community and more than half of its elected representatives support. So I really hope that between now and the end of this session, we can get some of the money that's associated with this, especially around neighborhood stabilization, micro-business lending, and the community financial institution support. But we also need to get some changes in the rules of the game with respect to building housing generally. If we want to solve for the problems that are right in front of us and start to make it possible for us to do two things: get a lot of people back up on their feet, and at the same time create the kind of housing we're going to need to deal with some of the historic issues that Secretary Keneally talked about with respect to zoning and housing production generally, which there are many terrific articles and great books that have been written about this. It's been a huge impediment for many years to providing the kind of access to housing that people of color deserve.
Most people aren't as close to this as you are. What is the pushback?
Translated, that was way too,
No.
wonky an answer. Yeah.
No. Well, what is the pushback that you've seen?
I think the biggest pushback to it is change. It's about change, and in many cases, change is a difficult topic and in some cases kind of a scary concept. But I'm, if there's one thing, and I thought Secretary Keneally hit this well. If there's one thing everybody's talked about the fact that COVID has laid bare significant issues that separate majority populations from minority populations, not just here in Massachusetts, but across the country. And housing is one of them that's right up there. And in most of the places where significant percentages of our communities of color operate, the process to develop new housing and affordable housing is profoundly difficult. And that needs to get fixed.
Governor, you mentioned the end of the session is coming. The calendar is like 35 days.
Yep.
This is a different kind of year. Would you recommend to the legislature that they consider extending the session this year? Because you don't know what's coming up in terms of COVID-related bills that you might need in August, September, October. If they've all gone, is that going to make it more difficult to get through what would be a second wave?
Yeah, I guess what I would say with respect to that is that the legislature established this 19, is this a 19-month session, 19 months, 20? 19. They established that 19-month session for very good reasons, and I am very supportive of why they did that in the first place and why they thought it was appropriate. And I'm certainly not going to tell them what to do between now and the 31st of July. I certainly believe they and we have a lot of things that we need to work our way through over the next 35 days, and COVID is certainly an issue that creates challenges for them just in terms of their regular business and creates challenges for the rest of us. And it really did put, in many respects, on ice a lot of the typical legislative work that would have been done in March and April, especially April, but a little bit the back end of March. And I think that's something that they should take up and discuss and make whatever decision they think makes the most sense. But I don't like it when we don't like it when they play in our world, They need to make whatever decision they think makes the most sense for them.
Governor, one thing on the legislature's agenda is this restaurant relief bill. The House passed it.
Yep.
It's been stuck in committee. It includes to-go cocktails and things that bar owners say would help them survive. Where do you stand on that? Would you like to see it passed, or what other relief can these restaurants and bars expect?
Yeah, we supported the restaurant relief bill when it was originally proposed, and that's one of those elements that I would hope would make it through the process. And in fairness, the legislature, despite the difficulty of the framework through which they have to operate now, has passed a lot of legislation that's provided significant support and assistance to many businesses and a lot of communities around Massachusetts over the course of the past 90 days or so. But we certainly support the restaurant bill and think it would be a good thing.
Do you know why it stalled then?
I don't. I mean, obviously, it's a disagreement of some sort between the branches.
Governor,
Governor,
question
a
about
lot of
testing.
outdoor stuff, I mean,
Just a
it's-
question about testing. Is it time to loosen up some of the guidelines around testing? For instance, if you're coming from Florida, if you're coming from a place like Texas, those places are seeing spikes. Should you be able to just come here, get a test, quarantine until you get those results back?
Can you wait a week for an answer to that question?
I-
That question and many others that have to do with travel generally are issues that were basically in the original reopening report that was done by the Lieutenant Governor and the Secretary and the committee were phase 3 issues. So we know they're right in front of us, and there are conversations going on about them right now.
So are you considering kind of loosening, I guess that's the best term I can come up with, loosening the guidelines for some of these tests? Is that what you're considering?
We are certainly having those conversations, and we knew that we would need to have those conversations in anticipation of phase 3. Yeah.
Governor,
The Cape is just getting inundated with tourists right now. Is there anything that is being done proactively just to try to protect the locals and just Massachusetts people looking for a place to vacation?
Well, the Cape ended up having, I think, 3 days of pop-up testing as part of the large gathering testing we did. And remember, most of the hospitals in Massachusetts at this point are testing just about everybody who comes into the ED and everybody who gets admitted, and they're submitting those test results to us. So Cape Cod, for example, hospital, which has a series of clinics and health centers and emergency departments and outpatient departments that are all part of its operation, are testing most of the folks that come in contact with them. And at this point in time, the positive test rate on the Cape is pretty consistent with the positive test rate across the rest of Massachusetts. It's around 2 or 3%.
have you given any more thought to mandating a quarantine for people who come from these hot zone states, as New Jersey, Connecticut, and others are doing?
Well, remember, there are constitutional issues with how far you can go with respect to what you do on out-of-state and out-of-state travel, okay? But we'll have more to say about this next week.
Quick question about the Holyoke Soldiers Home. There's a call to get the families involved on some of these reforms. Are you open to that and having their feedback on what you propose?
We're looking forward to one of the things. We wanted to wait until the report was done, but now that the report is done, we're going to schedule either virtually or in person, depending upon whatever makes the most sense for them, a conversation with the families to talk about what they'd like to see happen going forward.
Do you have any plans to go to the soldiers' home anytime soon, meet with the staff there?
All of that's going to be driven to some extent by the issues around how people would choose to do it, whether they would want to do it virtually or they'd want to do something in person. I want to be respectful of the fact that at this point in time, there are a lot of people who prefer doing virtual things to doing things in person. The Lieutenant Governor and I are you know, we like the out of the office stuff, but we get the fact that at this time, for a lot of people, they prefer to do stuff virtually.
Will phase 3 be the most risky? How does it compare to 1 and 2?
Well, I guess what I would say is that the whole point behind the way we've rolled this thing out, the things we started with earliest were the things we felt were the least risky. I mean, if you remember, going back to May 18th, it was manufacturing and construction. That was the first step of phase 1. The second step of phase 1 was sort of quick in and out personal services, haircuts, hair salons, pet grooming, and a couple of other of those kinds of items, and curbside pickup for retail. And then in phase 2, you know, outdoor dining first, along with some changes with respect to retail, followed by step 2, which was indoor dining. I mean, we've tried pretty hard here to make the things that we do earliest in this, the things we believe are A, easiest to comply with, B, consistent with the guidance we're getting from the public health folks about least risky, and third, trying to create that sense of compliance and acceptance of protocols and appreciation for the guidance and all the rest before we get to some of the stuff that when you get into phase 3, I think most people would say is a little more difficult.
I know you said you want 2 weeks of data from indoor dining
Yeah.
before deciding on phase 3. How do you feel about the first week, and if the data stays as good as it is, are we on track to start phase 3?
We don't really like to get too hypothetical about this because you just don't know what it's going to look like, but obviously because of the work that's been done by the people in Massachusetts for the past 90 days around masks, distancing, hygiene, surface disinfectant, cleaning, and all the rest, we've gone from, basically a 30% positive test rate with a few thousand tests to a 1.8% 7-day average positive test rate with 10,000 tests. And I think there's no question that people have done a tremendous amount of work to improve our situation, and that's part of the reason why on a lot of these national maps now, Massachusetts is one of a handful of states that people say has COVID sort of in check. But I always come back to the same thing on this, which is that this is a virus everybody should respect, and it's really important for everybody to keep doing the things that have got us here on a go-forward basis. And that's why for us, this is phased. It's why we did it in steps, and it's why we hesitate to put dates on stuff when what we're really trying to do is pay attention to the data. And you all know what the 6 benchmarks are. Well, we've had a lot of success in several of them. There are a couple there that we would like to see get a little better. Because we do need to recognize and understand that this is still very much with us. And for anybody who thinks this is over, I would just ask them to take a look at the data coming out of a lot of the states in the South and the Southwest, which had a very positive set of statistics week over week after week in the months of April and May. And now they're really starting to struggle. And I think we all need to understand that, vigilance and caution with regard to this is and serious focus on the data and on the things that stop the spread is where we really need to play. Thank you.